There is a sobering new projection that could make you want to keep social distancing. I'm Shayna Humphreys. Government models now predict we may soon reach up to 3,000 coronavirus deaths a day. The models are also predicting more than 134,000 Americans could die by August. We get it. It is scary. As adults, we can usually find ways of dealing with the stress, but for kids, many just don't understand what they're feeling right now, so they might be taking out their frustrations in different ways. Fox 29's Dawn Timoney joins us live tonight with a look at that. Dawn.
Well, Shayna, is your child acting out? Angry, anxious? It's okay. No need to freak out. Experts say it is completely normal under the circumstances, even expected, because they have never, ever experienced anything like this before.
I miss my friends and my teachers and the toys.
This is 3-year-old Beck, the son of Fox 29 executive producer Abby Miller. He knows why he's stuck at home.
You don't want to get sick.
But that doesn't make it any easier. Family therapist Dr. George James says the coronavirus is taking a terrible toll on our kids, often causing meltdowns and mood swings.
Just like some adults are frustrated or nervous or unsure, but we might do something with that. A young child might not know what to do with that.
He says giving them a little space can help.
Sometimes in the moment we try to fix it or control it, and they might not be able to do that in that moment. And so they might just need some time.
Many children are feeling lonely and anxious. 9-year-old Bryn Myers always had plenty of play dates. Not now.
I'm FaceTiming them and I'm texting them.
But it's not the same, is it?
Yeah. It's not the same.
Bryn's dad says his 3 daughters, who didn't always get along so well, are learning to be friends and playmates. And while he's now home for dinner every night and riding bikes with the girls every day, Robert Myers has serious concerns.
I'm seeing more and more evidence that they feel isolated, and it's very hard to keep them engaged. And I worry about the impact that's going to have on them in the long term.
Dr. James says talk to your children about how they're feeling and give them a little latitude right now.
I'm not saying that you just tell them or give them anything, but maybe a little bit more flexibility.
Caroline admits COVID-19 is making her irritable and wonders when it will end.
First it was like we had 1 day off school, then 2 days, then 2 weeks, then like till May 1st, then we didn't have school for the rest of the year, so I feel like I'm kind of afraid like it's just gonna go on and on like that.
It is not easy right now. Dr. James says don't be afraid to use the many resources that are out there, whether it's a therapist, a school counselor, your child's teacher, family, a friend, because we are all in this together, and this is definitely an instance of it takes a village. Shayna?
Absolutely.